Bismillahirrahmanirrahim. Assalamu alaikum. Respected audience, today my topic of discussion is about the atypical and unusual presentation of toxoplasmosis, how it should be evaluated, and what are its characteristic features which can help us in understanding this atypical presentation. Talk about toxoplasmosis, we know it is basically related to the Toxoplasma gondii infection. Cats are a source of infection. Properly, if the food and the fruits and the vegetables are not cleaned and washed, so they may be contaminated with all these parasites, and it may cause the infection which can ultimately lead to the eye. And the patient in acute stages, we know that they present with vitritis element and a typical appearance we call the headlight in the fog appearance over there. And later on, when the infection settles down by the use of antibiotics, and we can see over there the punched out localized scars. So these are the typical manifestations, typical characteristics which happen. But this patient who presented to me had both types of features, so I thought it very beneficial for my audience. So let's have a look at this first fundus photograph. Here we can see that the patient has got macular scarring in the right eye. There is macular scarring. Along with this macular scarring, there is inferiorly retinal traction membranes inferiorly. This fibrous and fibrovascular traction membrane are exerting traction on the retina, and these things lead to the retinal detachment. The third feature I will request you to see in this photograph, although not very clearly shown, is that there is a fibrous membrane, fibrous band we can say, which is extending from the disc inferiorly. And this fibrous band, which is extending from the disc inferiorly, it is causing traction on the retinal blood vessels which are emerging from the disc. And instead of having the normal emergence from the temporal sides, if you please have a look, they have somewhat nasal emergence, and then they straighten up and go towards temporally. So we also find here the element of situs inversus. So all these things, this is an old healed infection over there, the scarring has happened. And if we talk about the vision of this patient, right eye was counting finger 4 feet, left was 2200. These are the particular features I am talking to you about, the unusual atypical presentation in the right eye. Usually these types of tractional retinal detachments do not happen in the toxoplasmosis. We know it causes the punched out, healed, localized scars, which is the characteristic and typical. But these things, like these things which happen, these are also of particular importance. Reason, because it will ultimately affect the vision of the patient. And also, when we talk about this situs inversus, the traction on the blood vessels, it also affects the depth perception and stereopsis and stereoacuity. All these things are interlinked. So if we talk about the history of the patient also underwent the squint surgery. So all these things interconnected are happening. So now let's have a look at the images, how things are going on over there. This is the OCT macula, magnified image, as shown in the photograph. The same picture here, under the retina, subretinal extensive scarring, all the retinal membranes, retinal layers have been distorted, elevated scar being shown in this OCT macula of the right eye. This fundus autofluorescence, also very much beneficial. So kindly have a look at this fundus hyper autofluorescent lesion right in the fovea, near the fovea. If I say that bright appearance dot over there, it is over there because RPE cells are undergoing disease, damage and accumulation of lipofuscin pigments, and these things are giving us hyper autofluorescent appearance. Along with it, the damaged RPE layers, the retinal damage, all these things showing us hypoautofluorescence in the macula. And inferiorly, again, as I showed you that earlier discussed in the fundus photograph, that where there are tractional membranes, fibrous element inferiorly leading to tractions on the retina, all that area is hypoautofluorescent. This is the OCT which we have seen earlier, Heidelberg, showing us how the things are happening, how the retina is distorted, fibrosis, subretinal scarring, and old healed scar, all these things shown in the right eye. Now we have discussed about the atypical presentation, unusual, of the toxoplasmosis. The patient is having this disease for years. Now it is inactive disease, but its manifestations are still prevalent over there. Now we come towards the left eye, the typical appearance, punched out localized macular scar over there in the central area, which can be seen over there. So left eye has got punched out localized macular degeneration, over there lesion, and we will see further in OCT and autofluorescence. This is fundus autofluorescence of the left eye of the lesion. Here you can see well localized central area corresponding to the lesion and hypoautofluorescent localized central. In the right OCT macula, there was subretinal fibrosis, scarring, all those things. In the left, here you can say the retinal choroidal excavation is happening. Because of that localized circumscribed lesion, if you kindly concentrate on the retinal layers, the layers immediately go into a excavation pattern downwards. They take a dip, the retina over there, and that excavation is retinochoroidal because of the lesion, destruction of the retina because of the infection. Another Heidelberg showing us how that excavation is happening over there in the macular area in the other eye. The normal retina immediately goes and takes a dip and make this crater over there. So retinochoroidal excavation shown with the destruction of the different layers of the retina. In today's presentation, we have discussed the typical and atypical presentation of ocular toxoplasmosis. I hope my today's presentation will be beneficial for respected audience, particularly the residents who are undergoing training in ophthalmology, and also for the retina fellows. I want to thank you for your attendance and attention. Thank you.